This video will overview the COVID-19 point-of-care test. This video includes details regarding the supplies needed, how to perform a quality control test, how to perform a test on a patient sample, and how to document the results. Prior to completing the point-of-care testing, testers must ensure they have adequate PPE and have assessed the environment. PPE includes clean gloves, masks, and a lab coat. Please note that gloves should be worn over cuffs of the gown. Apply the gloves after donning gown, as shown in the image. Gloves must be changed between QC tests and patient sample tests. Lab coats or coverings must be worn at all times during testing. Lab coats should not be worn outside of the lab. When assessing your environment, please ensure that all testing is completed behind a splash guard. This is true for both QC tests and patient tests. Observant surfaces, or chucks, must be applied to the countertop prior to testing. Please ensure you have a distraction-free zone. If at any point you have any questions regarding the appropriate PPE for testing, please contact your unit's super user. Prior to testing patient samples, QC testing must be completed. QC testing must be completed daily or with manufacturer lot changes. Some of the materials required include the positive and negative controls, 2 cartridges for both the negative and positive samples, 2 pipettes, the splash guard, chucks for your countertop covering, the rack for storage, biohazard trash, cleaning solutions of bleach and alcohol, and a Sharpie for labeling. To begin the QC testing process, users must first log into the instrument. Do so by entering your username and password. Next, on the top right-hand aspect of the screen, select the QC tab. Select Run Negative QC. Please note that the negative sample must always be run before the positive sample. Next, type in NEG into the sample ID. After doing so, scan the cartridge QR code, which is located in the front aspect of the cartridge. After scanning the cartridge, you'll be prompted to select a test. For the COVID-19 testing, it's very important that you select the SARS-CoV-2 flu RSV test. In this visual, it is the second selection. After doing so, select Confirm. The instrument will then instruct you to prepare the QC cartridge. Leave the instrument and prepare the specimen at your workstation. To begin applying the sample, first open the blue top of the cartridge. Be very careful not to touch the protruding tip in the back of the cartridge. This can lead to invalid test results or a test failure. Prior to applying the samples, label one cartridge negative and one cartridge positive to avoid accidental errors. Next, open up the packaging of your pipette, exposing just the top of the bulb. To begin, invert the negative quality control 5 times. Do not shake the vial. Next, open the negative control, being careful not to touch the inside of the cap. This can be done by holding it between 2 fingers or by putting it face up on your clean absorbing cloth. Next, you're going to use your pipette to aspirate the quality solution. When doing so, be careful to avoid bubbles in the collection space, and try to avoid too much excess spilling into the overflow compartment. Next, you'll expel the contents into the right-hand corner of the cartridge. When discarding the pipette, please be sure to go around the specimen rack to avoid contamination. Next, recap your quality control solution. Next, you will close the blue cap of the cartridge until you hear a click. Please view the next clip on proper handling of the cartridge. There are a few considerations to keep in mind when testing. Do not touch the clear plastic center of the cartridge cap. This is where the probe enters the cartridge and could lead to contamination of the probe, module, and instrument. Do not deposit the solution into the center of the cartridge. Again, doing so will lead to contamination of the module and the instrument. When using the pipette to collect the solution, be sure to avoid any bubbles, as shown in the images. In addition, the first tester to open the quality control should mark the container with an O to indicate that the container has been opened. Testers must exercise extreme caution when handling the cartridge. Improper cartridge handling can result in contamination of the entire instrument. Instrument contamination will result in inaccurate result reporting for all subsequent tests performed on the instrument. The top and back of the cartridge must always be avoided. Transport the cartridge by holding the sides, taking special care to avoid touching the blue cap. Click Continue on the instrument to begin loading the cartridge. Place the cartridge in the module that the instrument has assigned. This will be indicated by a green flashing light. Next, close the module. You should hear a click. The instrument will then go through the process of verifying the cartridge. The operator should not walk away while this is happening. Once the cartridge is recognized, a runtime will be provided and the light will turn a solid green. Repeat this process for the positive control, except this time select Run Positive Control. Type POS into the sample ID for positive, as you did with NEG for the negative sample. This is very important. The negative control must always be placed on the instrument prior to manipulating the positive control. The two should not be held in the same hand when transporting to the workstation, and both controls should be stored away from any patient samples. Anytime a positive control vial is touched or manipulated, you must change your gloves. The workstation must be cleansed between QC tests and patient sample tests. In addition, the workstation should be cleaned in between each and every patient sample test. Both the counter and the splash guard must be cleansed. First, use the bleach solution. Allow the area to dry completely. Then follow up with a 70% ethanol alcohol solution. Again, let the solution dry. Once the sample arrives, testers must confirm the order in FirstNet or PowerChart. Testers must ensure that the work area is clean and that the QC requirements have been met and passed for the day. Log into the instrument using your ID and password. Again, using clean gloves, collect all your necessary materials and ensure you are wearing the proper PPE. From the Home tab in the top right-hand corner of the screen, select the green New Test button. From there, select the appropriate test, SARS-CoV-2 Flu RSV. Place the small square patient label on the side of the cartridge. This should not cover the QR code on the front of the cartridge. You will then be prompted to scan the sample, then the patient ID, and then the cartridge ID. After scanning all of the info into the instrument, confirm that your sample label on the cartridge matches the label on the specimen tube. This is particularly important when there is more than one patient sample queued to be tested. Begin by opening the blue cap to the cartridge. Next, obtain the sample. Invert 5 times. Do not vigorously shake. Carefully remove the cap to the sample. Using the pipette, aspirate enough of the sample to fill the entire pipette. Avoid obtaining bubbles. Next, expel the contents of the pipette into the large hole on the lower right-hand corner of the cartridge. Be careful to dispose your pipette around the sample tray holder. Recap the sample. Next, close the blue cap of the cartridge until you hear a click. This indicates that it's been properly shut. Click Continue on the instrument to begin loading the cartridge. Place the cartridge in the module that the instrument has assigned. This will be indicated by a green flashing light. Next, close the module. You should hear a click. The instrument will then go through the process of verifying the cartridge. The operator should not walk away while this is happening. Once the cartridge is recognized, a runtime will be provided and the light will turn a solid green. Once complete, the instrument will display Complete View Result. Any positive results will display as red, while negative results display as green. Open the completed module and discard the cartridge and the appropriate receptacle. Should a QC test fail, it should be repeating using a new cartridge and a new QC vial. Dispose of the vial used during the failed run. If a QC test fails a second time, please contact the POCT coordinator and halt patient testing on the instrument. Patient samples should never be run if 2 levels of QC, either positive or negative, have not passed. If a patient result fails, rerun using a new cartridge. Should it fail a second time, you will need to recollect the sample. Negative samples should be stored for 7 days in the refrigerator. They should be discarded on the 7th day. For example, a sample from Monday should be tossed on the following Monday. For the storage of positive samples, please ask your unit POCT coordinator. From within the patient's chart, select Point of Care Result Entry. Once the Point of Care Result Entry window opens, go ahead and make your selections on the left-hand side. Under Test Site, select the appropriate test site. Under Orderable, select COVID-19 Influenza AB RSV. Under Specimen Type, select whichever specimen is used. Under the Perform Date and Time, you can enter T to automatically enter today's current date and time. From here, you can modify. The time entered here should be the time that the specimen was collected. Under Performed ID, enter your ID number. The ordering position will default to whichever position is on file for the patient. In the event that you do need to change this, you can do so by clicking the magnifying glass and searching from there. To begin documenting results, double-click in the gray area. Doing so will generate the grid where results can be entered. A value must be entered for each 4 tests. If you wish to add a comment, you can do so by right-clicking and entering from there. After a value has been recorded for each entry, go ahead and click Verify. After doing so, you will see that the results will clear from this window. Your results will appear in microbiology. For any questions or process updates, please reach out to your PUCT coordinator or super user from your unit. As always, please feel free to send an email to the CHAMPS Clinical DL with specific questions.